in that way.
And they'll say things like, well, it's the only area in life that he has control over, and by golly, he's going to control when he has a bowel movement. I say, what animal on God's green earth willfully withholds his stool? Really?
Mm-hmm.
So you're absolutely right. So if you don't like what you're hearing from a physician's point of view, check with other moms who have special needs kids and say, who out there does have an ear for our kids and wants to help and be a doctor and manage pain and manage problems. And we don't have that anymore. It's hard to find.
And it is really hard to find. Even for general doctors, sometimes I think
Mm-hmm.
you don't feel good. And like you said, 10 minutes is almost a long time to be able to
That's
see
right.
them. And so, what are some of the questions that you would encourage the viewers out there to ask their doctors if they're finding, because it seems as though autism, as much as it's good for it in a sense to be a hot topic, which means more research gets in, more awareness, we also see there's a downside to that where a lot of people kind of jump on the bandwagon and maybe they're not as trained as somebody like you. What's something a parent could ask those doctors? For example, what happens if they need to get a hold of them in late hours? Like as a pediatrician, people would page you. So what are some of the questions these people should ask the
Well,
parents?
now these parents have to be very target fixated. So it's like you go into the doc knowing that he's got or she's got a very limited time with you and say, my kid's got diarrhea, and open up the baggie and let him see and smell the diarrhea. And you can say, did you ever smell that before on any kid? When we used to wear bow ties, and the reason pediatricians wear bow ties is because we would look at infant stools to be able to tell if they're sick or not, okay? And we didn't want to have these things drag into the poo.
Yeah.
Okay. So you go in there and say, my kid is constipated. Let's get an x-ray. He's constipated. What are the treatments for constipation? When do I contact you next? In other words, he says, well, take a couple of this and that, and how quickly does this work? When do I need to be concerned? Should I have results by Friday? Should I have results by Monday? Can I call you on Tuesday if it's not happening yet? Okay? So I think the biggest thing that we can do with our local docs is come in with one or two problems. My child is not sleeping. We've done that. We've done that too. Oh, we did that too. My child's still not sleeping. What do you recommend? You don't know? Could you look it up for me? Could you give me an answer tomorrow on what you'd recommend for sleep? And you just go in with one or two little things that you want, or big things, that you want him to manage or her to manage.
I was giggling because when you were saying bring in the diaper, I don't remember what presentation I'd heard. It might have been one of yours. Someone had said with a gastrologist that says that your child's holding their poop on purpose, bring the bag in with the stool and leave it in the office and walk out the door so they can understand that this is not what this is not typical. This is not what most people have to go through. And so I love the questions that you offer to the parents because to me, there's so many specialists out there that they'll say, okay, at 5 o'clock we're done and you can't get a hold of us. Well, what happens if all of a sudden at 3 o'clock in the morning your child is crying or they're upset or maybe they get sick and you have to take them to emergency? How do you explain to emergency some of the treatments that we're giving our children?
Well, sometimes it's if you're going to the emergency room, you're worried about something catastrophic going on. I mean, that's why you go to the emergency room. So are you thinking that your child's got appendicitis? I mean, I hate for one of these, oh, he's just screaming because he's got autism. No, this is a level of screaming that's a whole lot worse than we've ever seen before. We'll give him some Motrin. We already gave him some Motrin. The kid is, I've had kids go to the ER and we think it's appendicitis when it's really they are constipated and it's just hurting so very much. So you're absolutely right. The after hours management of autism is very, very difficult for any pediatrician, for sure, because they don't know what to tell you. And right nowadays, they have no incentive to meet you or whatever. They'll say, well, if you think it's that bad, you need to go to the ER. That's the only thing they're going to give you.
Well, and I know with your book, and I absolutely, the one that you wrote with Jenny McCarthy, I love that book. And the reason I love it so much is because, well, one, when you read it, and you guys, if you haven't got that book, definitely do. You can go to any Barnes & Noble, any of the Borders, any of the major bookstores. Sure, you can get it on Amazon.com.
Online's cheapest.
And what I love about it, though, is it's like a conversation between you and her.
Mm-hmm.
And the questions that most of you guys, if you're in your living room, and the questions that you're asking each other, like, gosh, what is this, or what is that? That book goes into detail and you answer them in such a beautiful way where it's not like I have to have that medical dictionary and look up your answers. Although, in your book, you even have, well, we can look up.
You certainly can. And that was the whole idea behind it, is to make it so that people who don't have a degree in medicine can actually read it. And it's also written in, like, constipation. Well, that's not my kid. I'm really not interested in hearing about somebody else's kid. You move over to the next next one, diarrhea, now that's my kid. Or the ear infection child, that's my kid. So it's written so you can kind of pass through those areas that you don't have information that's mixed up with other stuff and you can miss something.
Well, now do you see a correlation? It seems like so many of our kids, and I don't know what the percentage is, when they're babies in the very beginning, right? It seems as though there's markers that we maybe should be looking for prior to the diagnosis. One of them I see is perhaps ear infections and other things. Are there markers that we can, for families out there, especially if they're having any kind of doubt? You know, a lot of mommies, we have this mommy instinct.
Right.
You know, I know with my son, I knew at 15 months, but didn't get the diagnosis until 2.5. So are there markers that a parent should be looking for when they are, I guess, when the baby's young?
Well, you know, when you think about it, there's not too much that a baby has to do in the first 2 or 3 months of life. But if you're going to see something in the first 2 to 3 months of life, it'll be reflux, spitting up, okay? An irritable, cranky baby that can't settle, that would be number one. A baby that doesn't nurse well, doesn't latch well, that would be it. And 3 to 6 months, maybe some delays in rolling over, or at 6 months sitting up, you'll see some delays. Now, a lot of kids have normal delays, and that's okay, but you asked what are some specifics. Babies will stop initiating eye contact. They will not anticipate being held, you know, raising their hands up. When you hold them, they don't clench with their thighs on your hip. They feel like dead weight. They don't play peekaboo. 9 months, 10 months, 11 months, and they fail to form words like mama, dada, at least a word at a year of age. Those are soft signs. And of course, this whole epidemic of getting ear infections at 2 months, 4 months, 6 months. So, but remember, with autism, you have a group of kids, like my son, who started getting infections early on in life, okay? But you have a group of kids who don't.
Don't, absolutely.
You have a group of kids who, right up that first year of life, right up to their birthday party, they're doing just spectacular. Everything's on, okay? They've even got words, and then they regress later, which you asked specifically early on. So I have kids where the parents will say, you know, my little girl or my little boy wasn't right from the get-go. That could be true. I have other kids who say they were doing great until 15 months, and then at 15 months we lost words, we lost you know, the ability to focus, we're no longer making eye contact, we're becoming irritable and cranky, we're developing diarrhea, we're becoming very limited. We used to eat everything, now we're only eating 5 things. So there's different presentations. So it's not just one presentation, this is autism. There's quite a bit.
Well, what's nice, though, is that we don't feel like we're crazy when we hear this, because I remember at 15 months watching my son. He was that child who spoke and at his first birthday walked and was developing very typically with his peers, and then completely lost everything and went to those 5 foods and did that. And I remember,
You see?
absolutely, it was everything you just said. It completely, you know, brought back that time. But I remember going to the doctors and saying to them, could this be autism? And they said, well, he's too young. You know, you only have 1 child. Go home, you know, don't worry about it. And I wish there would have been more information even then, which was, you know, 7.5 years ago. We still didn't have as much as we do today.
But they still do it today.
So, and that's what I'm saying for the families. It's so great is that you don't feel crazy because, you know, we know
Oh, great. So I validated you, but it didn't help the kid, okay?
Well, that'll get them to continue researching, though.
Well,
you know?
they're not, you know, the thing is we're not getting any help from the major, you know, research facilities, UCLA or UC San Diego. I mean, when was the last time you've seen something coming out of a major university? Here's how we can do this, or here's how we can do that. It's coming from, you know, private organizations,
private third
checklists
parties,
and stuff like ARI with checklists and things.
Now, 2 more questions I have for you. One, how do they find a doctor? Like, do you have any ways? How do you find?
One of the best ways to find a doctor, and again, it depends on where you are. I mean, if you're in concrete Washington, you're not going to find anything near you, and you may have to travel to Oregon to see somebody. One of the best ways is to talk to other moms who have special needs kids and say, who do you see? Both from a general pediatrician point of view, because you need somebody to go to who's not going to harass you every time you walk in there and snicker at you because you're on a dairy-free diet or one of those cockamamie gluten-free diets that don't work. I'm saying that tongue-in-cheek and facetiously. You want somebody who will be supportive if you decide to vaccinate or not vaccinate. You need somebody there to help you with that. And then I think to find a doctor, there are some lists out there, but generally word of mouth is the best when you know somebody, or there's a group like Generation Rescue Talk or whatever that can say these are doctors. They're being very careful what they say because, you know, in this legal climate. But best from another mom who says, hey, we've gotten very good results working with this doctor or that.
Now, a question that I get a lot asked to me is parents that want to have another baby and or a person that's never had a child, but yet they seem to know moms like us that have a child with autism. So the first question I get when a brand new mom is pregnant is, what should I do?
Oh, there's so many things. You know, we don't know yet, really. The bottom line is we have some ideas. I think, first of all, you have to get really interested and read up on the vaccine controversy. And there's several good books out there. How to Make an Informed Vaccine Decision by Mayor Eisenstein is a great place to start.
He's great. I love that.
Okay.
Yeah.
And I think that's a good place to start because, you know, everybody's talking about, did the flu shot do this while I was pregnant, or did hepatitis B do this? I mean, so there's a controversy out there, and a lot of parents who are very concerned about that. And then you get into the vitamin D camp where they say, you know, moms with autistic kids had low vitamin D levels. So, well, that's an easy one to fix. Let's make sure that you're getting plenty of vitamin D3 and that your levels are measured, okay? And then the prenatal vitamins. Are you taking the good prenatal vitamins? And are you assuring yourself that you're getting enough, like folic acid? And then you talk about, well, what am I cleaning with? Am I still using harsh detergents to clean the house, or am I switching over to the organic cleaners? You know, so I think it's a good idea to start doing that. But you know, there are so many things and we just don't know yet. Because the research is not out. I'm just thinking of common sense things that if you were going to have another baby, or you know, if my daughter-in-law were to have a baby, these are things that I would tell her to do.
Things that just try to help you live a healthier life in ways. I think our kids are really teaching us the way to live. Honestly,
Yeah.
my son, if you were to come into our home now, but came into our home when he was first born, I mean, I didn't know about the organic cleaners or the filtered water or the purifiers in the air and, you know, all that good stuff that we do today.
Right.
And I really think he's probably saved our lives. I think all of our kids have.
Definitely.
So now I want them to be able to find you. So how can they locate you on your websites, find your books, I know you have products as well. How do they get
Well, I
where you are?
recommend everybody to go to www.mendingautism.com, MENDING autism.com. And that's a website that is non-commercial. It's just there to provide information. My treatment protocols for constipation or diarrhea or infections or ADD, you know, I have a lot of families who are doing pretty good, but my kid is so attention deficit disorder, I just can't stay focused, or obsessive compulsive behaviors. These are things that we do in our clinic that have worked that you can do on your own or with the help of your physician. So if you got a physician who's helpful, you could say, hey, look, I think my kid's yeasty. Can we try these things that I read? And I think from there you can go to other websites to get more information. But mendingautism.com is where I send folks.
Okay, and then also, guys, don't forget, go to generationrescue.org because he writes the newsletter, or you're one of the main columns. And I think, are you there also monthly or answering questions, or is that through?
Yeah, no, we answer questions too. So if you write in, they send me questions. So on a Saturday when I've got nothing to do, I just sit down and answer all the
You
questions.
have nothing to do, I'm
Yes,
sure. Well, it's been such a pleasure talking with you, and I want to thank you so much for taking the time.
Well, thank you very much for having me.
And to all of you guys, I want to thank all of you for allowing us to bring hope into your home. Until next time.
Thank you for joining us for Autism Approved with Kristen Selby Gonzalez. Please join us next week for another episode brought to you by Enza Medica.